In this video, we'll talk about Spina Bifida. Spina Bifida is one type of neural tube closure defect. So what is neural tube? In order to understand that, we have to understand the 101 of neural development. So neural development is roughly happening around the day 21 to 28. And in this case, you can see the embryo from a top view. So in this case, the flat sheet of ectoderm would fold into a tube-like structure which would eventually give rise to the brain and spinal cord of the embryo. So you can see the cranial end and the caudal end are demarked here. Eventually, there would be folding of this neural tube, and the cranial and the caudal end would create a neuropore, a small structure which need to be folded to close the tube. Eventually, these structures are closed completely. By day 28, this event is done. So let me summarize. By looking at a top view and a cross-section view, you can see how these flat sheet of ectodermal cells are defined as neuroectoderm, and they fold into a form of tube. And this neural tube is the precursor for our entire nervous system, including the brain and the spinal cord. Now, neural tube defect occurs when the cranial or the caudal end fail to close. If the cranial end fail to close, it leads to a situation known as anencephaly, where the entire brain is kind of missing. And when the caudal end fail to close properly, it leads to the situation known as spina bifida. So moral of the story, spina bifida is a neurodevelopmental disorder which is resulted due to a failure in caudal end of neural tube closure. Now there are different subtypes of spina bifida. So this is how a normal end of the spinal cord look like. Here you can see the vertebral bodies, the spinal cord here, and the spinal processes as shown in this case. So there are three types of spina bifida. One is spina bifida occulta. Occulta in Latin means hidden. So in this case, nothing really happens. It's kind of like the most mild form of spina bifida. Some cases, it has been seen that one or more vertebrae of the spinal columns would be malformed, or in extreme cases, they could be missing. So this is the most kind of like benign form of spina bifida, and there are some amount of hair development on the back. Nothing more than that. Then the next type of spina bifida is meningocele. In meningocele, a portion of the meninges protrudes out at the back, and it forms a pouch-like structure which is filled with cerebrospinal fluid. And in this case, no nerves are actually protruding out of the layer of the skin. And it may have minor symptoms, but most of the cases, the major conditions of spina bifida is basically myelomeningocele. In this case, the spinal nerve as well as the meninges protrudes out and form a pouch-like structure. Sometimes the external skin could be completely missing. That means it is open and exposed to the external surroundings. That is why this is sometimes known as open spina bifida. In meningomyelocele, which is difficult to pronounce, the spinal cord and the meninges protrudes from the child's back. Many cases there are no skin on the back. Bones of the spine do not completely form in this case, and this has resulted in incomplete spinal canal and the protrusion of meninges and the spinal nerves. Spinal nerves are now exposed, so they are more prone to damage, and there is also risk of infection from the external world. This can lead to many symptoms, most commonly loss of sensation and paralysis in this area. Now let's talk about the risk factors of spina bifida. One of the biggest risk factor is malnutrition. So nutritional status, especially the folic acid deficiency, then exposure to environmental toxicant, obesity and diabetes are the potential risk factors. And above all, there are some genetic predisposition among some ethnic groups which make them more vulnerable to develop neural tube defects. Now, Pregnant women should take always vitamin B9, folic acid, and iron before even thinking of pregnancy, because everything is happening within the nervous system is developing within the first month, and in that case, before even she knows that she is pregnant, the neural tube closure is done. And in that case, if you don't have sufficient amount of vitamin B9, most likely it is going to create a neural tube defect. So now it is advisable that every woman who is thinking of conceiving until 12 weeks of gestation should take high level of folic acid. Now, cases of neural tube defect shows a very high incidence rate in the third world countries, because in the third world countries there are malnutrition and problems associated with diet, and they have very low level of vitamin B9. Now, diagnosis can be done using ultrasonography. Also, there are biomarkers such as alpha fetoprotein, which can be detected from the amniotic fluid or even in the blood. High level of acetylcholine esterase is another biomarker. Treatment option involves like prenatal surgery, which is dangerous, but surgically closing the defective neural tube is one of the option. Some cases, doctors also prefer to do a postnatal surgery, and surgically closing the neural tube is the only option, which can minimize the risk of meningitis and other infections in the later age. So I hope this was useful. If you like this video, give it a quick thumbs up. Don't forget to like, share, and subscribe. See you in next video.